All right, well, thank you, and what a huge honor it is to get to be with you today and start part of this just incredibly rich program. Over the course of, over the course of about 3 weeks last year, the New York Times broke two stories. The first showed that declining bat populations in the US were associated with rising infant mortality rates. The second showed that deaths in the US from hurricanes over the past century had been really dramatically underestimated. In the first study, a researcher showed that in counties where a fungal disease, white nose disease, had wiped out bat populations, that farmers responded by increasing pesticide use by 31%, presumably because the loss of bats had led to an increase in agricultural pests. He then noted that in those same counties, infant mortality rose by 8%, apparently because of the increased chemical exposures. The second study, 3 weeks later, showed that mortality from hurricanes in the US was dramatically higher than anyone had anticipated. From 1930 to 2015, there were 4 to 5 million excess deaths resulting from hurricanes. This number represents about 3 to 5% of all mortality in the continental US over that time period. And the number has been accelerating since 2001 in line with the increasing frequency of hurricanes resulting from climate change. These stories are part of a bigger story, the story of planetary health. The field of planetary health has really exploded over the last 10 years in recognition that the Earth crisis has become a global health and humanitarian crisis. Climate change, biodiversity loss, global pollution, and other environmental changes are degrading the foundational conditions for human health. The quality of air we breathe, the quality and quantity of food we can produce, our exposure to infectious diseases, our exposure to extreme weather events, and increasingly the habitability of many of the places that we live. As a result, we're seeing large burdens of disease across every dimension of health. In my own research, for example, I've found that rising concentrations of carbon dioxide in the atmosphere are making our food less nutritious and pushing hundreds of millions of people into the risks of nutritional insufficiency. We found that wild pollinator declines are causing about 500,000 deaths each year as a result of reduced production of the foods that protect us from heart disease, strokes, certain cancers, and diabetes. We found that changes in fisheries associated with ocean warming are putting nearly 1 billion people at risk for nutritional deficiencies, and that changes in land use in Indonesia are actually causing about 36,000 deaths every year from air pollution. These are just a few examples from my own research, but in an article that we published this summer in The Lancet, we showed that changes in any of the planetary boundaries that we use to track the stability of the Earth system have health impacts across every dimension of human health. So this is where we find ourselves. This is what Martin Luther King described as the fierce urgency of now. The way we have come to live is choking the life out of the planet. We as health practitioners are starting to sound the alarm that we can no longer effectively do our jobs. We can no longer safeguard human health into the future while the natural life support systems that we depend on are crumbling under the weight of our own collective ecological footprint. The good news is that there is a rich landscape of solutions to shift the way that we live across food and energy systems, manufacturing, and the built environment, to bring humanity back into balance with our life support systems. Universities can be critical catalysts of that transformational change through our work in research, education, policy, and practice. And the role of the Johns Hopkins Institute for Planetary Health is to stimulate exactly that sort of transformational scholarship. In the American context, communications is, I think, a critical component. At the Institute for Planetary Health, for example, we've been thinking about the opportunity in the United States to train some of our most trusted messengers, nurses, physicians, public health practitioners, first responders, to respond rapidly to climate change disasters, to help communicate to the public the connections between climate change and their health and prosperity. As we sleepwalk toward the edge of a cliff, it's our responsibility in the health sciences to sound the alarm and help humanity move on to a different trajectory where we protect the natural life support systems that sustain us and the rest of life on Earth. Thank you.